The EWC lift is easy to use when lifting someone from a bed. First, be sure if there is a bed rail on the opposite side of the bed that it is placed in the up position. Roll up the side of the sling to be placed under the patient to the center point of the sling. Place the rolled portion of the sling under the arm of the patient closest to the caregiver. Roll the patient up onto their side and tuck the rolled part of the sling behind them, aligning the center of the sling with the center of the patient's back. Roll the patient onto the sling and up on their other side. Be sure to position yourself in front of the patient so that they cannot roll off the edge of the bed. Roll the rolled portion of the sling out from under the center of the patient's back and smooth it on the bed. Roll the patient back onto the sling in a flat position. Take the leg extension on the opposite side and pull it under the patient's leg. Then position the leg extension on the sling on the leg closest to you in the same way. Move the lifting bar over the patient, lowered to a position close to their waist. Hook each lifting strap on the sling to a carabiner on the lifting bar. Be sure to cross the leg straps to the opposite side carabiners. Make sure the patient's hands are safely inside the sling and move the lifting switch to the up position on the control handle. Lift just until the sling straps are taut and then check to make sure that the patient is properly positioned and comfortable. Continue lifting until the patient is off of the bed. If the patient is in a flat position in the sling, move them to the side of the bed and while holding the back handle on the sling, lower them in the lift. This will upright them into a more sitting position. If they need to be uprighted further, pull up on the handle on the back of the sling. You are now ready to move the patient to their new location.